This is positional fault testing. We palpate the transverse processes of the lumbar spine and assess for symmetry first. Remember, if we palpate the PSIS, the transverse process should be about the width of those, if not slightly more medial. We may have to push the paraspinals medial to feel the TPs, or use the palms of our hands and apply greater pressure to feel where the transverse processes lie. During assessment of the transverse process, we want to know if we feel one is more prominent than the other. If, for this example, if we notice that the right transverse process is more prominent than the left, we know that either the right transverse process is stuck down and back, or the left transverse process is stuck up and forward. To determine which it is, we ask the patient to do one of two things. The first is ask the patient to come up into the sphinx position to introduce extension to the spine. Staying with the example, if the right transverse process is no longer more prominent than the left, we can assume that the right transverse process was stuck down and back. If, however, we notice that the right transverse process has become even more prominent than the left transverse process, we can assume that the left transverse process was stuck up and forward. When the patient rises into extension, the facet joints close down. So in this example, if the right transverse process was higher than the left, we could assume that this segment was stuck down and back. Sorry, you can't see that very well. But then when we go into extension, it exaggerates any down and back or up and forward movement of the spine. Another way we can determine which segment is stuck up and forward or down and back is to ask the patient to come up into a quadruped position, causing the facet joints to move up and forward on one another. We again must repalpate the same segments we were on, their transverse processes, and assess the height of each compared to the other. If in this case, in prone, using the same example, the right transverse process was more prominent than the left, we could assume either the right transverse process was down and back or the left transverse process was up and forward. If in the sphinx position, we feel that the right transverse process is no longer more prominent than the left, we can assume that the left transverse process was stuck up and forward. If the right transverse process becomes more prominent than the left, we can assume that the right transverse process was stuck down and back, or is stuck down and back, and is unable to move up and forward. When the patient moves into the quadruped position, the facet joints open, and so if one's stuck down and back and it's unable to move up and forward, that transverse process would become even more prominent than the transverse process above it.